Hello, everyone. I'm Dr. Sandeep Sharma, Pediatric Super Specialty Faculty at Ladder. And the INISS results are out, and we have Dr. Parul with us. Dr. Parul, as I just came to know before this interview, she has been my student from the days of PG entrance exam. And right now, she has cracked super specialty exam as well. So, INISS, she has got rank 5 in pediatric critical care. And it is my privilege to invite her to this interview. So, welcome, Dr. Parul, and congratulations.
Thank you, sir.
So, Dr. Parul, can you please tell me about your background? Where did your UG PG from, and where are you working right now?
Sir, I have been born and brought up in Bihar, and in 2013 through NEET I joined Neelratan Sarkar Medical College, from where I did my MBBS. And in 2020 I joined again NRS Medical College for my MD Pediatrics, and I have completed my MD Pediatrics last year, that is in 2023. And right now I'm working as a senior resident at Calcutta National Medical College.
And so this was your first attempt at the exam, or you have previously appeared as well?
No, sir. I actually gave my first attempt when I was giving my MD final exams, because pediatric critical care is such a topic that I had no clue how to go about this. And especially what we hear that it is a central institute, you don't know what will come, how will you prepare? So I gave at that time to just see what is my level and how should I go about it. I did not qualify. I knew that I will not qualify. So after my MD exams, I was just preparing for my MD. I started my critical care preparation. And in November, I secured a rank of 18. I crossed the cutoff, but I was not shortlisted for the interview. So I was happy that yes, during the last 6 months, I did something substantial that added to my knowledge. Then after my November, I took a break. I started again. And this time I was shortlisted for the interview, but I did not know how would the interview go. So I just kept a calm mind, and by God's grace, I secured a rank of 5.
Great, great. So how was the exam for you? Like the pediatric critical care, you have appeared in it now a couple of times. So what was the weightage like? What were the areas from where questions are being asked? And what were the things you found that maybe you could have done better?
Yes, sir. Still today, I feel I could have done better if I would have been more present in the questions. They are not difficult. You have to study Nelson. The first book that you have to study is Nelson, because they ask 50-30. The ratio is maximum time 50-30. 50 questions from your core subject and 30 questions from general pediatrics. So whatever we study in the 3 years, that 30 questions will be from there. And we should always remember it is an exam of elimination. It's not an exam of selection. So there will be 5 to 7 questions which none of us will be able to answer. So don't chase those 5 to 7 questions. Chase the rest of the questions. And over the years that I have learned that those 23 or 25 questions will be basic, that we see every day in our clinical practice. They will be asked in a rather difficult manner, but our approach should be clear. That yes, I do this. This is the approach. And for critical care, I will say, just learn the basics first. When we hear critical care, we always remember, ventilator, we have to learn the graphics. But no, critical care is not that. We have to first start with the basics, the ALS, BLS. And the topics are always the same. The topics will be repeated, but you have to be updated. And I think that is what helped me over the years, that the topic was always repeated, and maximum was from the subject, from the book that we studied. It was not something out of the syllabus. We just have to know how to approach the question, that if we attend to a patient in critical care, in our critical care unit, what do we do? They ask the question such that, have we really worked in our wards, or are we just reading the books?
True, true. In fact, what Parul is just saying, it is very similar to, with a different phrasing. What one of the doyens in the field of pediatric critical care has said, I will not take his name because it will become woe. But he also used to say the same thing, that whenever you think of pediatric critical care, you start thinking about all these fancy stuff and ventilators and all. But he said it is actually the basic stuff, like basic triage, what is the next step in management, shock management, ABG, acidosis, diabetic ketoacidosis management. These are the things which make you pass or fail in the exam. Ventilators are only for deciding whether you will get a rank 1 or rank 2. For getting into top 5 or 7, I think it is the triage part and it is the basic clinical approach in critical care which is important. And I think Parul has very rightly said, in a different way, she has also said the same thing. So all those who are targeting pediatric critical care, yes, all these fancy stuff, all these new investigations and ventilators and graphs, they are needed, but not at the cost of your basic day-to-day practice. So Dr. Parul, your opinion on how the exam has evolved, and as you said, can you be more specific that which are the things apart from Nelson people targeting pediatric critical care should be incorporating in their preparation? Those who have time.
Sir, actually, first we need to read Nelson. The initial preparation should be from Nelson. We have to switch to, because this is a central institute, we should always read AIIMS protocols that are there. And we should always remember that it is not only pediatric critical care, so PICU will be asked. NICU can also be asked. So we should brush up our basics there too. After reading the basics from AIIMS, NICU, PICU, we should always be aware of the recent updates, the GINA guidelines, the PALS that is present, because they will ask those updates. It will not be a hi-fi question. It will just be a small update that either we don't know or we have missed. So the ARDS guidelines, surviving sepsis guidelines, they have been asked extensively. And we need to, as a critical care person, we should have a basic knowledge of the umbrella knowledge of everything. In-depth knowledge of few things, but an umbrella knowledge is needed to manage a child in triage. So I think we should always read the initial. In Nelson, there is a first chapter regarding the basics. So I think those chapters are very important, and always focus on the guidelines that are there, the updates, and most of the things that will be covered from there.
In fact, updates are going to be a problem for upcoming residents also, because now new Nelson has come up. AIIMS protocols, so new
Yes, sir.
protocols have already come, and now Nelson 22nd edition. Reading Nelson cover to cover is not that possible, but there are, yes, updates in the treatment part also. Like as I just recorded a video recently for PrepLadder, so, spinal muscular atrophy, new drugs have been introduced. So far, we were knowing that it is only nusinersen, but now you have onasamnogene and risperidone. Their routes of administration, side effects, regimens, they all have been added in new Nelson. So all those aspirants who are targeting the future exam, Dr. Parul has very clearly said 50-30. Those 30 questions will be from expected areas, but in case there are updates, please be updated with your knowledge. And for the remaining 50, please focus on AIIMS protocols along with both the newborn one as well as the PICU protocol, and be thorough with your clinical approach. And if you are honest with yourself, I think things should be done. So Dr. Parul, any role of PrepLadder in your preparation for super specialty?
Sir, I think my entire notes that I prepared during my residency, I subscribed PrepLadder at the end of my second year before my third year. So during the 1 year that I had the time, I prepared extensive notes from PrepLadder. And my entire MD preparation, initially in my mind, I did not really prepare for critical care because my motto was first clear this MD exam and then move on to the next step. So for my MD preparation, I had this extensive notes. And as other people say, first prepare for NEET, then INI will already be taken care of, which is to some extent true. So initially I prepared for NEET with that mindset. Though I did not get a very good rank, I got a rank of 400. So, and the GTs that I gave in PrepLadder made me realize where I lacked. I need to prepare more. So eventually I kept on revising those notes. I did not make new notes. I did not add on much to my notes. I had a initial note prepared during my PG days. And eventually when I shifted to core critical care, I just brushed up those notes. I gave a GT. I focused on, okay, so these are the repeated topics. In PrepLadder also, I saw there are few topics that are repeated. And those repeated topics will be asked in some exam or the other. So eventually, I think the entire preparation of my entire notes, so thanks to you, from my PG days, every student has been comfortable with your way of teaching. So first we listen to your videos, then we read Nelson. So Lensil becomes easier. So our approach, me and my friends, whoever prepared, so maximum of us here, our approach is same. First listen to your videos and then read Nelson.
Thank you so much. That's a big thing coming from you. See, Nelson is a tough book. Till my till my MBBS days, I was a Harrison guy. Then when I moved into this thing, Nelson was actually a bit of a shock because Nelson is actually more intensive, and it is a difficult book to read, but it is also a wonderful book to read, and there is no substitute for that. Because I had my own struggles with Nelson, so I try my best to simplify it for you, and glad to know that it helped. Parul, now that the exam is done, you have also appeared in NEET SS exam. Difference between NEET SS versus INI SS that you feel our students should know.
That actually NEET SS is now at present an exam which will ask everything. For example, in INISS, we will be asked general pediatrics and critical care or whatever topic that we are studying. But NEET, what problem I faced, they asked ENT, eye, skin, these small topics which we generally do not focus. We see a skin case, we ignore it. Okay, we refer. But the pinpointers that they asked, they were easy questions, but we don't pay attention to those topics. And it is genuinely impossible for a student to cover in a 6 month or 1 year duration the entire Nelson, the entire pediatrics.
True.
So that is in NEET, that is different. So I think I found INI in that aspect a bit easier. But yes, INI has less number of seats, so the stress was comparatively higher.
True. Dr. Parul has said a very pertinent point. Like some years back, there was a question in NEET SS, similar, like not the same question, where they had asked about the treatment of molluscum contagiosum, and the child had lesions on the face as well as on the genitalia region. Now, this is something that we either don't treat or we refer to, or we just apply salicylic acid and those kind of thing. But the concept was that you don't apply any salicylic acid ointment if it is a genital lesion, and so you had to rule out the options. So such kind of thing, because we refer and we don't see it, this is needed in NEET SS, but INI SS, it is more focused and more repetition, more details they go into. I think that is the difference. So Dr. Parul, this success would not have been possible without the support of many other people, your teachers, your parents, your family, your friends, people you would like to take names and attribute this success to.
So first, I would like to thank my parents because from my childhood, my parents have been instrumental where I am today. They have always supported me, and my parents, they believe in me. My father tells me that I should always try harder because he knows I can achieve it. I would like to thank my brother, my sister-in-law, who always tell me to stay calm because they know that I'm not a calm person. I panic a lot. And they always remind me to take breaks, to enjoy life. They tell me that it's okay, you're a doctor. That doesn't mean you have to take too much stress. And I would like to thank all my mentors, so especially you. And I would like to thank my faculties at NRS Medical College and Calcutta National Medical College, especially Momita ma'am, Kaushik sir, Khushbu ma'am, and Vichitru sir, who have always inspired me in critical care that yes, it is achievable. And I would like to thank my friends, Dr. Ruchi, Dr. Bhageshri, Dr. Mayank, Dr. Darshana, Dr. Aishwarya, Dr. Shomodeep, Dr. Aradhya, for always motivating me and keeping me focused. They were the people that I could discuss my studies, and they were always there with me. So I think my entire journey is because of Prep Ladder and my friends and my family. So thank you all.
Thank you so much, Dr. Parul, and we wish that you attain the zeniths of success in the field of pediatric critical care, and whatever exams you give, whatever endeavors you take, you succeed in that. And I'm quite sure you are going to do that. On behalf of the entire Ladder team, I congratulate you again, and we wish you all the very best for all the future endeavors of yours.
Thank you, sir.
Thank you, Parul.